Hello, everyone. My name is Ramirez with MedSchoolCoach. I am joined today by Dr. Sheena Mathew with OnlineMedEd, who she runs a lot of their curriculum development, and we're so excited to be talking to you today. We have a very special webinar for you today. It's really timely, and it's really in response to a lot of questions that we've recently gotten about the current times in the pandemic. And the title of our webinar is Maximizing Your Clinical Rotations, Lessons for During and After COVID-19. So we're really going to focus on how you can learn clinical medicine essentially from your bedroom. So as all these students have experienced, a lot of students are spending more time at home than in the hospital for their clinical rotations. And we've gotten a lot of questions about how in the world they're supposed to learn clinical medicine while not being in the hospital. And we're hopefully going to use some tips and tricks to do that. So a little bit about us. Myself, there is me on the left. My name is Joel Ramirez. I'm the Director of Medical School Tutoring at MedSchoolCoach. MedSchoolCoach is a company that's really committed to students. We help people get into medical school. We help people be successful in medical school with one-on-one tutoring. And then we help people have successful applications to residency. So I went to medical school at UCSF, and I'm currently a resident at UCSF. I've been tutoring board exams for about 3 or 4 years now, and I've been overseeing our amazing group of tutors now for about 2 years. We have more than 90 just incredible tutors really committed to their students' education. And then my disclosure is that I am an employee of MedSchoolCoach. We are collaborators with OnlineMedEd. And I also like to say that the information that we usually give on these webinars, I would say are applicable to 80 to 90% of the students, but I do want to emphasize that everyone is slightly different and your situation might be slightly different. So you really want to take this information that we're giving you and really personalize it to your situation. And then we have Dr. Sheena Mathew here, and I'll go ahead and let her introduce herself.
So my name is Sheena Mathew. I'm trained in internal medicine, and I am new actually to OnlineMedEd. I just joined them, and my major role is helping faculty use the platform and actually help them teach you based on what we have. I'm sure some of you are familiar with our website, but we mostly have a lot of curriculum starting with the first 2 years of med school all the way through your clinical rotations. A little bit of background about myself. I did all my training in New York City, went to med school at Downstate, and then did my residency at Cornell on the Upper East Side. And then from there, actually worked as a hospitalist for a couple years. So I was at University of Virginia originally, and then did my last year as a hospitalist at Memorial Sloan Kettering Cancer Center back in New York City. And now work for OnlineMedEd, and excited to be here with you guys and share some tips, hopefully, that will help you get through kind of this very unique time in history. I can say, like, we definitely feel for you. I remember being a medical student and, getting through those first 2 years and being so excited to make it to the third year and to have that kind of experience kind of shortened or, not exactly how you intended. Our hope was that this webinar will help you, make the most of it. And I hope you realize by the end of it, you can still be adequately prepared with the tools that we'll share with you during this talk.
Okay, thank you, Dr. Mathew. So today we're going to talk about a few things. We're going to try to keep it fairly concise. I do want to emphasize that at the end of this presentation, we will do a question and answer. And this is really your chance to send us whatever questions that you have, and we'll answer them. And I think this kind of gets back to what I was saying a minute ago, is that your situation is very unique. And so you can ask us now questions that are very unique to your situation, and we'd be more than happy to answer them. So as we make our way through this presentation, please feel free to put questions in the chat function or the Q&A function, and we will get to them at the end of this. So we are going to talk about how to maximize your learning through a digital clerkship, adjuncts for learning clinical medicine at home, digital sub-internships, and what lessons we can take with us in the post-COVID world. So how can we learn from this situation and move forward to be better physicians? And I'm going to go ahead and pass off to Dr. Mathew here, who's going to go ahead and get us started.
So let's start off with how we can learn through these digital clerkships. So first of all, I just wanted to say, I know although this is non-traditional, we still feel pretty strongly that you can, it's still an effective means of learning the information, and also, I would say, even more importantly, having you adequately prepared to start your residency. And just like it would be on the wards, we recommend a case-based approach. I mean, I always remember when I was a student, the way I learned best was through cases, and that's not going to be any different learning on the wards versus online. So cases are key, practice is key, and you'll hear us kind of repeat that throughout the presentations. Although you may not be physically on the wards, there's still opportunities to feel engaged and feel like you're interacting with residents attending. So that would be through lectures, morning reports, case conferences. And I know it may not feel the same way being through Zoom instead of being there in person, but I would, recommend you take advantage of those opportunities just as a way to feel more connected and make sure you are getting that type of experience. But it's not perfect, right? So there are some things that maybe you wouldn't get the full extent of it. So what would you miss? So the first point I have, the culture of medicine is what sometimes people call the hidden curriculum. It's the stuff we may not actually say, but it's what you pick up, with your time on the ward. So whether it just be like a simple thing, like what does rounding actually feel like? What does it mean to do a good oral case presentation? How do I actually get something done on the wards? Those are the lessons you learn by physically being there, putting in the orders, calling up the consults, just understanding how it all works. I mean, when I think about medicine and like that transition from second year to third year, it's kind of like almost like a study abroad program, I would say. Like the first 2 years, you're learning like the language of medicine. And then third year, you kind of just are thrust into it, thrown onto the wards and really kind of feel that culture of medicine. And that's how you really kind of grow. And, and unfortunately, that's very hard to make and digitally, but we hope that with some of these other tools we're going to go through, you can at least have the background so that when you get there, you can make the most of your time and you'll be prepared. Other things that are difficult to kind of do online, communication with patients, staff, having those difficult conversations. It's hard to do at home by yourself, but again, we'll hopefully show you some tips to get through that. Physical exam, another one that is a little bit difficult when you're just doing it at home, but again, there's ways to get around that. And then I think the hardest part is probably the procedural and surgical skills. Joel, I don't know. I mean, you have any thoughts on that since you're in the surgery specialty versus internal medicine?
Yeah, no, I think it's always really nice to be, in the hospital, hands-on, learning how to scrub in and things like that. I think in reality, a lot of the surgical skills could be taught on your own, or at least could be learned on your own. When I say surgical skills, I'm thinking just like basic, like what is a needle driver, what are pickups, how to close skin, how to close like a simple wound that you would learn as a medical student. I think the one thing that would be challenging is the rules of like an operating room and the experience of an operating room. But I think in reality, a lot of the skills, like the technical skills that you need, I think even if you were there in person, you really want to learn them on your own anyways, that if you do get an opportunity to actually do them in the hospital or in the operating room, that you kind of have some familiarity with them anyways. So I think in the big picture, YouTube is really great. There are a lot of really great resources online, free resources to kind of teach you how to use these things. You can buy the tools pretty cheaply on Amazon and just kind of practice on your own if that's something you're passionate about. I have one question for you, Dr. Mathew. For the culture of medicine, the hidden curriculum, how to use a telephone and how do you call consults and things like that. Do you know any good resource for that, that students can use on their own or at home?
In terms of that, I feel like a lot of that is really best felt like when you are physically there. I mean, that's tough. I mean, you could read, I almost think reading books like House of God or something just to kind of get a little bit of a background on what it feels like to be a resident would be helpful since you may not get to physically experience it. But I have noticed, just because I've been able to work at different institutions, it is different everywhere you go. So wherever you end up for residency, you're going to pick it up and you're going to get it. So I wouldn't stress too much about it. But that's I think a hard thing to kind of mimic at home in a home setting.
Yeah, I think that's a good point. I mean, the consulting and how the phones work and everything are slightly different every hospital anyways. I think regardless of wherever you go and at whatever time you are on your training, you'll have to just kind of figure it out on the job.
right, so the next piece is what we're going to just delve into what specifically you can do at home to master some of those skills that you may be missing out on. So first thing is cases, like I mentioned before. I mean, this is really the backbone of what clinical rotations are, right? Seeing as many cases as you can. And this kind of holds through for residency as well. So a really great tool is CaseX. I don't know if for anyone that has had the opportunity to look at it, I think the best part about it, they're actually real cases. So these are patients that you would encounter on the wards. They have a lot of them. There's over 90, and they have kind of the most common subspecialties. They don't have everything, but what you're most likely going to encounter. And one of the great pieces of it, it starts with a video and the patient actually giving you the HPI in their own words. So, it's not the same thing as you going in and asking the questions, but at least you get that example. And again, for me, the best way I learned and the best way stuff stuck with me is when I heard it in the patient's word through their own words and then kind of following the case through. So I think it's an excellent resource. They've kind of organized it very well. I didn't have anything to do with creating this. So they go through step by step, help you work through the differential, interpret the labs, interpret the imaging, just like you would do on the wards. And this was built, obviously before all this happened, and it was made just to be a supplement to, your clinical rotations because, on the wards, you can't really predict what you're going to see, but at least this would cover the most common cases and stuff that you would be expected to know for your shelf exams. So I think it's a great kind of alternative for not being able to see your own patients, just to go through these cases and really, at least get a feel for what it would be like on the wards. And again, the more you practice, the more you go through these, the better prepared you're going to be when you actually encounter these problems yourself on the wards.
In some ways, that might be like almost better to learn medicine. So I remember being like a third year clerkship student, and like you don't always see a lot of bread and butter things. You're seeing like these like way out things that you've never seen before and that aren't really tested and probably way over your head. And so I'm sure CaseX has probably kind of cherry picked like the more common things that you really should be able to recognize.
Exactly. That's what they did. And yeah, I can tell you, like my last year is working at Memorial Sloan Kettering. I mean, it's a really fun place to work, and we see some very interesting things, but it's not what you're really going to see on your test. And it's a lot of stuff that's really out there. So this is a great supplement. And I think for now, it would be an excellent place to start to really hone in on your clinical reasoning skills. And then I would say, since, maybe you're not physically on the wards, there is a way to kind of make the most of it. So just kind of taking it a step further. So once you do go through the case, you have the opportunity to practice all those skills that you would have done had you been on the ward. So first being, now that you've gone through the case, how would you present that to your attending? Even though you're home, maybe by yourself, you can still give an oral case presentation. Because again, I can tell you, that's one of those skills that you won't get better at unless you practice. So you have 90 plus opportunities to do a case presentation. I mean, that's pretty equivalent to what you would be doing, maybe even more than what you would be doing on the wards, taking care of one or two patients. Kind of continuing on that along those lines, you can practice calling a consult or, writing the admission orders as you go through, practice writing notes, handoffs, discharge summaries, all those same skills that, you are going to need to do when you become an intern. You can do them just based off of these online cases. And I know sometimes it's hard when you're by yourself, but this is a good opportunity to talk with your med school friends or even bring it up to your faculty if you have small groups. I know most internal medicine, at least curriculums, have a small group component to it. So maybe meet with your small group and see if your faculty is willing to be a mentor for this and review your presentations or your discharge summaries. I'm sure everyone was willing to do whatever it takes to make sure you guys feel prepared and feel ready. So I mean, you really can do everything you would have done on the wards just using these cases. And then also, Dr. Ramirez, I don't know if you want to talk about what MedSchoolCoach can do with this as well.
Yeah, totally. So I think, MedSchoolCoach is one of my roles to do is to kind of lead all of our tutoring, medical school tutoring division. So I would say we spend the majority of our time working with students through step 1 Step 2 CK, COMLEX Level 1, COMLEX Level 2, and then some Step 3 and Level 3. But I think recently we've seen folks who have been signing up with us to get help with their clinical skills. And I think there are many ways that we can do this. And I think actually the one-on-one kind of system, I think actually works very well here. So you can actually work with one of our tutors to do all these things and to practice all these things. And I think that's particularly valuable because then you can actually get some formal feedback and really specific feedback. So how to call a consult, how to do a presentation, writing notes, things like that. And it's kind of nice that you could just get one-on-one tips, tricks, and feedback. So I think it is a kind of a new utility of medical school tutoring, but I think it's something that could be really useful, especially if you're looking just for some extra help or just really helping, looking for someone to confirm that what you're doing is the right thing.
Mm-hmm. Right. So then going into history taking. So this is one of those things that's, it's an art. It takes lots of practice, like I had said before, but basically to do it, the things you recommend is just being systematic about it. That way you ensure you don't miss anything, and you'll realize after you do this over and over, you'll be able to tailor this to your patient better and not have to go through the whole thing. Practicing as much as you can. Again, difficult when you're at home, but online, luckily there are lots of videos. I would, recommend, obviously YouTube is good, but even like some of the societies, like I know Society of Hospital Medicine has some videos that you can look to and just kind of for practice sake, just to see how somebody would take a history. The CaseX videos are good. One other thing I thought, obviously up to your relatives and see how comfortable they are talking about their medical history. But at least in my family, everyone's always more than willing to talk about what's going on with them. And especially during this time where everyone's kind of feeling more isolated and alone, it may be nice to reach out to some of the older relatives or family friends and see if they do want to give you a little bit of history about what's going on with them. And, obviously let them know this is not a, medical encounter and you're not eliciting or giving any advice, but I think it's a nice opportunity. Just the more you hear about things, the more comfortable you're going to feel with how people describe things. Because that's, I think, is a big thing about medicine. The symptoms, what to look for, but people sometimes say them in different ways. So the more times you're exposed to this, the more different, scenarios you can kind of create at home, I think the better it would be. So the more you can kind of find ways to either online listen or talk to your family, I think it would only be to your benefit.
I think, I'm sure your experience is a little different than mine, just the difference of fields, but I think that a lot of when you're learning a history, like history taking, I think as a medical student can be overwhelming just because you're going down so many rabbit holes and you don't know where to go next. And I think one of the things that becomes really useful is to create kind of a regimented approach in your own mind. Like I'm going to ask about an HPI, the APQRST, then previous medical problems, surgeries, hospitalizations, medications, allergies, and then like social and family history. And I think in many ways, you can get that system down on your own. Like you don't need to be in front of somebody going through that system every time. And as long as you kind of develop a system that works for you, some sort of cadence, and then you just practice doing the same thing over and over again. Because I know at least in kind of the surgery world, we try to do things fairly concise and fairly quickly. And I think we don't want to miss anything either. So I try to cover things in bullet points like that. And again, you don't really need to be in the wards to develop that system for yourself.
Yeah, I think it's very fair. And yeah, it's something, it's probably better to practice it before you go onto the wards, because then once you get there, you can make the most of that time and perfect that skill that you've already kind of laid down the groundwork for. So physical exams. So this part obviously is a little bit more challenging. Again, so practice is how you learn. But I will say, if you do have access to family, friends, the more normal exams you do, it'll be easier for you to realize when something is abnormal. So really, it's not a bad idea to just practice on people that you know are healthy, because it will help you you'll be pretty obvious once you do feel something that is, not normal. That being said, there's a lot of great resources online for this. So the Stanford Medicine 25 is an excellent way to learn physical exam. And YouTube, of course, has tons. In terms of procedures, this is obviously a little bit harder, but I can tell you, you know, when I was a resident, what we would do is we would always watch like the New England Journal video on paracentesis or thoracentesis before we actually did it. So it doesn't hurt to like go through these and see what all the steps are. So that way, once you're on the wards and ready to see one in person, you already kind of have it down and be ready to do them soon enough. So I know for at least medicine procedures, that's a good resources. I don't know, Dr. Ramirez, I don't know much about surgery, like what you would recommend for them.
Yeah, no, I think the same thing. I think the New England Journal of Medicine videos are really great. I think if you have a particular interest in a certain surgical subspecialty or something, YouTube is, I mean, there's so many resources online now where you can just like see someone's point of view from the surgeon, like the entire operations, if that's what you would like to see. It's not the same as being there, but it is kind of interesting to just try to experience it. So you literally could just Google online, you know, different surgical videos, and there are usually many YouTube channels and other like paid websites, which you don't necessarily need, but there's plenty of ways to actually see surgeries. What is the Stanford Medicine 25, Dr. Mathew? I have not heard of that.
Oh, you haven't heard of it. So basically, it's just a collection of basic physical exam maneuvers, and they just have videos for each one, and like how to do like hepatojugular reflex, or like how to do, you know, a cardiac exam, how to do a lung exam. So it's the basics really, and that's kind of how they tell us to teach based off of like these videos. So I would recommend if you want to make sure you're learning how to do
maneuvers. Is that where the 25 comes from?
I don't know where the 20, if there's actually only 25 of them. That I'm not sure of, because I know they're expanding it, and they also have some ones on ultrasound now, which is, I think, a great skill, something I am interested in personally, but especially for you guys that are just starting off, it's going to be everywhere. So might as well learn it now while you have some time. So I think it's an excellent resource and highly recommend. And I think it's free. So. Okay, so communication. So this is another really important piece to becoming a physician, and something you usually tend to only learn once you are on the wards. Again, it's hard to do when you're just at home, but you can practice this with friends, with potentially faculty members or MedSchoolCoach. It sounds like a good resource for doing consults, handoff, getting that feedback you need to make sure your communication skills are improving, because it is something we know that if you are a good communicator, it does lead to better patient outcomes. So it is something that, you know, may not be formally taught in med school. At least I know when I was going through, maybe it was mentioned a little bit and maybe now more, but it's really worth taking the time to perfect. And, you know, a lot of times people just assume, oh, you'll get better the more you do it, but that's not always necessarily true if you're not getting the feedback you need. So it's better to actually kind of think of it as another skill, just like you practice your physical exam. Communication is another thing you can practice. And one resource that was recommended to me by my boss when I was at UVA is Communication RX. It's an excellent book. It really goes through kind of any like interaction you ever would kind of encounter while on the ward, starting with, you know, how you should best approach a patient encounter, how do you deal with a difficult patient, and really just gives you like a nice toolbox to have. So I would say, you know, I obviously only read this once I was an attending, but I wish I had read it earlier on, so that way I didn't have to learn through trial and error. I would have had those resources with me. So I think if, you know, I know you guys are busy and there's so much stuff to read and there's, you know, overwhelming amounts of information out there now, but if you have time to slowly go through it, I really think it would be for your benefit. And again, communication it's an incredibly valuable skill. So if you don't have the time, you know, if you aren't able to physically be on the wards, this is a, you know, a good adjunct to help develop that further. Is it a
long book?
It is. I have it here. It's not that long. It's like this thick, but it's an easy read. Like very easy read. He has like case examples, which makes it more fun. The last piece is about like how to teach communication. So obviously you don't need to read that part, but like the first 2 chapters are really good and I think relevant to medical students.
Great.
Yeah.
All right. And then I'll pick up from here. So I think one of the things I really want to emphasize is that whether you're on the wards as a third year medical student or like at home participating in a digital clerkship, I think that in reality, content is still king. Like, you're still there to learn medicine, and you're still there to learn a lot of facts and a lot of concepts and a lot of theories. And so you can do that whether you're in person in the hospital or at home. And I think there's a lot of benefits to being in the hospital, but if you're not able to be in the hospital, there are also a lot of benefits to being at home. And I don't think something that I hadn't quite realized, but as a third-year medical student, you spend the whole day in the hospital and you go home and you read, because you go home to try to learn additional things that you're not seeing during the day. So regardless, you're still reading a lot as a third-year medical student, whether you're in the hospital or not. And I think doing the work, like the kind of working from home clerkship, the benefit of that is you get more flexibility, and you potentially could have more time at home reading and kind of learning on your own. So I think that it is going to be really important that you take advantage of that and make sure that you have a good kind of curriculum for yourself in your mind for how you're going to learn the content during your clerkships. And I think that there's, we won't get too into detail about the resources per rotation, because that's kind of that's a really large topic. But I think what you want to look for is you want to read every day, and you want to identify a resource or a textbook per rotation. So if it's internal medicine, you could do something like Step Up to Medicine, or if it's surgery, you could do, Pestania's surgery or things like that. Identify one book for each rotation, read that every day, and then work on questions. So use a question bank that's clinically oriented. So a question bank meant for, for your either the shelf exams or for a Step 2 CK or Level 2. And you can use the questions in OnlineMedEd. Amboss is a great question bank. And then obviously everyone knows UWorld, but you really want them to be focused for Step 2 CK or even Step 3. And then you can always turn to things like UpToDate and Medscape online for kind of the nitty-gritty details of clinical medicine. Although I would say a lot of times that goes into much more detail than you necessarily need as a third-year medical student. But if you kind of want to dig a bit deeper and you're confused on on a certain subject, you can go there for additional information. But really want to emphasize that regardless of whether you're in person or at home, you're spending a lot of time independent learning. And so being from home is just going to give you more flexibility to do more of that on your own. Digital sub-internships are kind of a new weird thing. So for those of you who don't know, digital sub-internships have been offered this year, and they're kind of like a digital sub-I or like a digital interview or away rotation. And they've been offered by different really competitive subspecialties, a lot of the surgical subspecialties, to really help augment the traditional away rotation. So a lot of surgical subspecialties and kind of competitive subspecialties normally relied pretty heavily on students doing these away rotations. So the students will go to a new institution, and they'd spend 2 to 4 weeks there. It's a chance to get to know the program. It's a chance for the program to get to know you. And it usually plays a very important role in kind of the match process, because you have a better sense of what you like, and the faculty have a better sense of what you are like. And so what they're doing this year is they're doing like a digital sub-internship, which is like a new thing, and it's utility and practicality are kind of unknown right now. That everyone's just kind of trying to figure out how they're working. Their format really varies. Some programs are doing a single day, like sub-internship. Some are doing like 2 weeks, and some are even doing 4 weeks. And they're usually, and the format's really different per program, but usually it's some combination of lectures, case-based discussions, grand rounds, assigned readings, and sometimes even student presentations to give you an opportunity to kind of get yourself in front of the camera and present to the faculty and present to some of the other medical students. And the overarching goal is to give the student an opportunity to learn a bit more about the program, things that you can't necessarily get by just reading about them online. And that's kind of a sense of the faculty, a sense of the trainees, a sense of the institution, and a sense of the culture. I think the actual practicality of if you can do that over Zoom is still a little bit unknown, but that is the goal. And I think regardless of how it's set up, I think what you want to do, if you do participate in these, then I think it's important to kind of show up prepared and ready to make your best impression. These are supposed to be kind of like interview rotations. And so I think it's kind of hard to make a good impression over Zoom. I do think that if you do participate in these, make sure you show up and appear engaged, try to ward off the Zoom fatigue, have some coffee, put your video on, make sure you're on mute, but put your video on and participate in any discussions that they come up. And really you can look at these as opportunities to network and kind of, these are really focused on students who are interested in certain competitive subspecialties. It's not a thing for all the subspecialties. I know Dr. Mathew said, not really a thing for internal medicine residencies right now, but I can tell you for vascular surgery, they are definitely a thing, and there's a lot of programs doing them. So think about really if this is going to be useful for you, and then if you do participate, make sure you try to be as engaged as possible. So, kind of thinking about what we're learning now and how we can apply that in the future, I think that there's a lot of really important things that we could take out of this, and I kind of mentioned it earlier, but I think it's really important to recognize that you are an independent learner, whether you're a third-year medical student in the hospital, outside the hospital, as a resident, as an attending, you're really always learning. You're kind of always, often teaching yourself. And so I think it's a really good habit. It's really good to get into the habit of reading on your own, using different online resources to learn on your own. So in this instance, we're talking about CaseX, things like the Stanford 25, and the New England Journal of Medicine videos. But the New England Journal of Medicine videos were actually originally made for the whole medical community. And so attendings will often watch those videos to brush up on how to do procedures as well. So it's really good to get in the habit of really seeking out new information and applying that information to your practice and kind of learning how to do things on your own, obviously with some additional direction, but really kind of doing the background reading on your own. I think it's important to review as many cases as possible, whether you're in the hospital or outside the hospital. And I think that you always want to use the resources around you. So if you have family and friends, videos online, Google, you really want to get used to using these and seeking these out. And then I think when you are eventually back in the wards, which you will eventually be back in the wards, and you have to make it back to the hospital, I think that you really want to stay engaged and present in those activities. And I think the things that you're probably going to want to focus on, because there are things that you're not going to have exposure to yet, is really what Dr. Matthews had mentioned earlier about the culture of medicine, the unwritten curriculum, like we're talking about how to call consults, how to use the phone, things like that. And I think in all things in medicine, you really get out what you put in. That's true for an in-person clerkship. That's true for digital clerkship. That's pretty much true for anything in medicine. So I know it's frustrating to be in this position, but I really want to encourage you to engage with the opportunities that you do have for you and really try to get the most out of it. And I think that if you do that, I think that there's a lot that you can gain from this experience, and I think it will be helpful for you in the big picture. All right, everyone, thank you for joining us. So that is the first portion of our webinar. Now we're going to move on into the question and answer section. So please put your questions in the chat box or the Q&A function, and we will get to them. Again, this is your opportunity to get your personalized questions answered, so definitely encourage you to take advantage of it. All right, hi everyone. Thanks for joining us. I hope that you found that useful. I hope that you got something out of it. Now is our chance to do some of our question and answers. So I see some questions in the chat. Please send more. You can put them in the chat, or you can actually put them in the question tool, and then we'll have a chance to answer them. So send them our way, and we will get you your personalized answers. Well, first one we'll start off with is from Aruj Chowdhury. And he is asking, as a third year, one of the issues with the remote clinical rotations is not actually getting real exposure to different fields. How then am I supposed to figure out what I want to do in medicine? Dr. Mathew, what do you think about that?
Excellent question. It's a tough one because, yeah, you really do get most of that exposure from being on the wards and seeing for yourself if this is how you can envision yourself in that situation. One thing I would think about is if it's possible to get in touch with residents that are going through those fields while you're doing your rotations, just to get their point of view. That way you can ask the questions you want to ask. I know it's not
a perfect substitute for actually being there, but at least getting their perspective is a great way to get a feel for, is this someone that I kind of see myself like, or not really, they can usually give you more of the details about the rotations. Or if there is some type of mentorship type program at your hospital, like, are there attendings that are willing to talk to you? I know everyone is doing what they can to help out these days. So I think trying to talk to as many people as you can in those fields would be the most helpful. But I would also say, when you go through your clinical rotations, it can be very different depending on which hospital you're at. I've seen very varying, experiences myself just going through. So I think actually the biggest thing is you really need to love the material. Like, I've always liked internal medicine, and that's what really made me want to do it. My husband's a cardiologist, and now that he's doing that, that's what makes him happy. So if you love the material, even if it's difficult, like, you're going to be willing to do the work because that's what you want to do and that's what makes you happy. So that's what I would say. Also, just if you find a subject matter that really clicks with you, you probably will be happy doing that throughout your residency.
Yeah, definitely. And if you have a chance to do electives, or if you're in your fourth year, I guess fourth year might be a little late, depends on how your curriculum is set up. You might be able to sneak in a few electives in your fourth year before actually applying to residency. That's really useful. You can always try to figure out ways to get clinically involved. Different hospitals have different rules regarding this right now, like shadowing. I know some places are allowing it and some are not allowing it, and some are allowing it in third year medical students, but not like first or second. So definitely take those opportunities, ask those questions, see if there are opportunities for you to go see what these things are in person. And if there are not, then do your best to get involved as a fourth year in those electives and try to get that experience as well. And then I think at the same time, the one thing that hasn't changed is it does continue to take some reflection and some thought about what interests you as far as like a general topic and a general subject. But I do agree, it is definitely a more challenging situation to be in right now. I guess you could think about what you enjoy to read about versus what you didn't enjoy reading about. What material did you find interesting? With I think one theme with the digital clerkships is how does one stand out, and then kind of a similar question, how does one obtain a strong letter of recommendation? And I think that the answer to this, I'll give my perspective, and then we can hear from Dr. Mathew as well, which is probably not too different than whether you're in the hospital. It's the same thing. You read before, you show up prepared, you know about your patients, you're nice to people, you're kind to others. Obviously, you're not working with a lot of support staff like nurses or technicians or things like that. But you still really want to be really always nice and kind to your teammates, and be really engaged. I recognize that might be a bit harder because you're sitting in front of a camera most of the day. But I would do your best to try to remain engaged, ask good questions, read as much as you can before and afterwards. And frankly, that's not too different than in-person medicine. And I think in many ways it could be easier to make a good impression because one of the challenging things about doing medicine and you're doing your clerkships in person is a lot of the systems are overwhelming, like the hospital, like how things work, and that can sometimes make it more challenging to make a good impression. So you actually don't have that in that situation.
I think I would just second what you said. I don't think it's that much different because when I think about like when I'm writing a letter of recommendation for a student, it's all those things you mentioned, right? People that are prepared, people that are engaged, even when we're talking about other patients that are not their patients, asking those good questions. If a question comes up on rounds and then, you go and look it up for us and report back the next session. I mean, those are the things that really let people stand out amongst other students, but really just being present, being engaged. And I know it is difficult doing this from home, but that's, when I'm looking for things to write in my letter of recommendation, it's those specific examples. We had this issue, they found the data, we talked about it. It was very helpful for the team. Being nice to everyone goes a very long way. Either if you're virtual or in person. So yeah, I think it's a lot of the same stuff. And, if you could get that extra time with your attending just to talk, that's always helpful. Like I always like to do feedback sessions with my students, make sure you're still getting that virtually because that's a big thing. And that really helps us get to know you guys better and write those more, personal letters of rec.
Right. And then, everyone knows you're in this position. So people understand that they're going to be writing you a letter of recommendation without ever actually like meeting you potentially one-to-one. Like that's not an abnormal thing to do in this situation. So to feel comfortable with the people you've worked with a long time, to continue listening feedback, and at the end of your rotation, also feel free to feel comfortable asking them for a letter of recommendation. They totally understand where that's coming from. I see a lot of discussion about Stanford Medicine 25. I'm glad that you guys were able to find that website and that use as well. Regarding digital sub-internships, they're offered by a lot of programs. If you're interested, I'd go to the program website. It's more than just a handful. There's actually several of them. I'd go to the program website, look for like a medical student tab, and see if they're offering it. If there's nothing there, then you can also find the program director on that page and send them an email and ask if they're offering any kind of digital experience or any kind of visiting clerkship experience that you could participate on, if you would like to as well. Let's see, some other questions. I see some questions that are a little more focused on content, which we're happy to answer if there's no other questions focused on kind of like digital clerkship. I'm happy to answer those as well. I guess regarding the resources, I do think it's really important for your success to try to get your hands on some of these resources. I know that some of the programs have certain scholarships, like OnlineMedEd has, I believe, scholarships or to increase access. You can talk to your school administration and see if they have access to Amboss, OnlineMedEd, or UWorld. Some schools actually provide subscriptions to these services. I know a lot of schools provide subscriptions to question banks or things like that. And then if there's nothing available, I do think it's reasonable to ask if that's something that they would offer for their students as well, in response to the question about getting your access to resources. Any advice for current fourth-year students who have limited access to away electives? I think that you're kind of in the norm here, and Dr. Mathew and I actually kind of talked about this. It was kind of interesting that she had never heard of like a digital sub-internship. Like it's not for some specialties. So you totally might be fine not doing away or visiting rotations. It's a thing I know for vascular surgery. I think from some small surgical specialties, but I think for the majority of specialties, you're probably going to be fine without having to do any away or visiting rotations. And then if you are interested in one of those kind of surgical subspecialties, then I do think it's reasonable to try to participate in one of these digital clerkships. Again, I don't know, as I had mentioned, I'm not really sure what the yield of it is, but I think it's reasonable to participate and to try to make a good impression and see what it's like. It will likely, could help you. If anything, it could help you understand the program a bit better and get a better sense of what you might be signing up for. Dr. Mathew, are you aware of any free core or electives available online, or like maybe not necessarily core or electives, but any like clinical learning resources online other than like Stanford Medicine and New England Journal?
Yeah, I saw that. I mean, those are I think the big ones. And then, I mean, again, free, I'm trying to think. I mean, YouTube has tons of stuff that, I mean, you can probably find lots of, at least for physical exam, you'll find everything you need to find there. But in terms of like full electives or such, I'm not exactly sure, but the COMLEX it's great for kind of practicing, but unfortunately that is not free. But like Dr. Ramirez had said, see if your medical school can help you get access to those resources, because they can be very helpful, especially if you don't get the time to actually interact with as many patients.
And I think in the current situation, I do think it's worth investing in these resources, and I understand that it can seem like it is a large investment up front, but I think this is really going to be a core learning experience for you that it's really necessary that you have. Now, again, I also think it's useful to talk to your medical school, and if you're struggling to find these resources or struggling to learn these things, to see if they can subsidize anything or could provide their students with anything. I think right now, it's kind of a choose your own adventure. Not a lot of these schools administration aren't really sure what to do in the current situation. So if you brought up the fact that you think that this could be a useful tool, or that you think you could benefit from it, they might be able to provide it to you as well. I think as far as questions, that's it from like the digital standpoint. I see a few questions on like step 1, step 2. I'm not aware what the chances are for IMGs to get into elective right now. I know that there are some challenges with that. We do work with a lot of St. George's students at MedSchoolCoach, and they've experienced challenges getting rotations. I do believe it's more difficult, and unfortunately I don't have a lot of advice as to how to fix that, other than to continue to work with your school administration and see if they can continue to try to put you at the front of the list to try to get those rotations. Do you know of any digital OB-GYN internship or shadowing programs, Dr. Mathew?
That one, I personally am not too familiar with OB, so unfortunately I don't have anything.
And then CASEX would have OB cases as well.
It does, yeah. CASEX has an OB section, so I would say that's a great resource for going through the clerkship.
Yeah, I think so too. And for like the question on like online resource, like an online course or elective, I think that the OnlineMedEd course, like the clinical courses are excellent, and the CASEX, those resources are really excellent. And I think if you're looking for something more other than just a question bank, that might be where you want to go in addition to get more of like lesson-based things as well to help you move forward. All right, everybody. I do see a few questions on step 1 and step 2 preparation. It is a little off topic and a little more in depth. I'm happy to answer some of these questions. If you could be some specific and what about these exams you had some questions with, like study schedules or things like that. We have about 10 minutes left, and we're all yours for those 10 minutes. So happy to answer any questions. But you'd have to be kind of specific for the USMLE, just so we don't go too far down a rabbit hole. Dr. Mathew, what are the steps to enter internal medicine?
In terms of a residency, I guess is the question. I mean, honestly, that's probably one of the most straightforward ways residencies to get into. I mean, after completing your clerkship and then your sub-internship in internal medicine, really, that's kind of all the minimum requirements that you need. Some people do away sub-internships. I mean, it's not common, but you can, especially if there's a particular program that you're interested in, or if you are coming from, out of the country. When I was at Memorial Sloan Kettering, we did have a lot of international students that would come and work with us as a sub-internship, as a way of, getting letters of rec from doctors in the US, and also just getting the experience of what it's like to work in the US. So it is, it's not something I think a lot of US medical students do, but if you are coming from abroad, I think it's an excellent opportunity to try the sub-internship. I know now, obviously, it's a little bit harder to do, but in the future, when that opens back up, I think it's a great way just to make connections and network, just like you would do in any other subspecialty.
Great. There's a question about doing research right now, and I'm assuming that the question is, since some labs are slowed down and some there are less opportunities. I've heard reportedly there are less opportunities to do research because people are kind of bogged down. Labs are closed, or at least a limited capacity. And I'm not sure how much of an effect this will have. I would just continue, if it's along one of your interests, I would continue to pursue those interests and continue to work with your school or your mentors or clinicians you're working with to identify opportunities for you to do research. You can do a lot of research without even being in person. So a lot of this stuff you can do with data sets or at home. You can do it at home with just like access to the EMR. So I think from that perspective, it may be more challenging to do in-person basic science research, but doing things like clinical research should not be too much more difficult. So if that is within your interest, I'd continue to pursue those interests, and I would hope that it wouldn't be too affected by the current situation.
Yeah, that's what I was going to say. I mean, a lot of places I'm more interested in clinical research. Like a lot of that can easily be done at home. Systematic review, like you just need access to the library, and that's about it. So you definitely have the opportunities to do those types of projects.
It's my favorite kind of research from home. So, lots of great opportunities there. All right, everyone. Well, thank you so much for joining us. I hope you found it to be very useful. We will put the video on our YouTube channel. If you had missed it, you would like to rewatch it. Otherwise, we wish you the very best of luck in getting through medical school during this trying time, and hope that you can utilize some of the advice we gave, and then also some of the resources and the things that we mentioned to make sure that you are able to kind of stay on track during this time. And I know it's really challenging, but I just encourage you to remain positive and to take what you do have, which are some really great resources and a lot of really great online learning tools, and to do your best in learning this stuff.
All right. Have a good night, everyone. Thanks for joining us, and best of luck.
All right,